Mass exodus of Nigerian medical professionals, care professionals and social workers may be looming, and the United Kingdom, which halted his visa issuance because of the pandemic, has announced a new health and care visa policy that could attract doctors, nurses and health workers in Nigeria and other countries to strengthen its national health service. The new visa policy aims to make it cheaper, quicker and easier for healthcare professionals to go to the UK beginning from August. Estimates have it that there are over 4,000 Nigerian doctors in the UK, spread across 83 subspecialties. Nigeria's Minister of Health, Osagie Hanire, has advised doctors seeking to relocate to reconsider, stating that the UK will not pay them hazard allowance. Joining me now from Benin City on Skype is Dr. Osahan Enabulele. He is the President, Commonwealth Medical Association, and the former President of the Nigerian Medical Association, as well as the Chief Consultant Family Physician at the University of Benin Teaching Hospital. Dr. Enabulele, it's good to have you join me on TVC Breakfast. Now,
thank you, Mike.
Thank you. Now, the Minister of Health, Osagie Hanire, is trying to discourage doctors from leaving to the UK. I wonder what you make of his statement to them. One would expect, or one would say that maybe he has something systematic and maybe a plan, a grand plan on how to negotiate to keep the doctors back instead of leaving for the UK. Can you confirm that, or what is your perspective to this?
Well, thank you very much. I honestly would not want to dwell so much on the statement said to have been made by the health minister, because I want to believe that he may not have made that statement. But if he made that statement, then I think it's not really expected from such an officer, because beyond just talking, we expect to see very pragmatic actions on ground, strategies being put on ground, visible plans to, of course, not only grow our health workforce, but to, more importantly, retain them. We do not want to see speeches upon speeches without having very responsive strategies that will, of course, serve as some level of, attraction for our healthcare workers to remain in Nigeria beyond just talking, because the whole push and pull factors are very clearly well known to them. We all know what the differences are, the disparities between what obtains in Nigeria and in most other African countries and poor economies, compared to those of the developed economies. And even at that, you find out that those who are even much more developed in terms of their health systems and their economies are even the ones that are even more pragmatic and responsive and proactive in terms of seeing how they can engage more highly skilled professionals from outside their countries to come and beef up their systems. So beyond just talking, we want to see what actions are on ground, what systems are on ground, what strategies are on ground to retain these health workers, to prevent them to, of course, serve as some level of attraction, some level of inspiration, to prevent them from traveling. Otherwise, you're going to have many more beyond the 58 that was reported to have been, prevented from traveling, out of the country, especially now that the restrictions are being relaxed. So this matter is not new. But what is worrisome is that rather than addressing it in a more responsive way, we are seeing, little or nothing being done to prevent this whole burgeoning phenomenon of brain drain. So it's going to be at our loss, at the loss of Africa, because Africa today has a lot of, in fact, over 25% of the disease burden of the global space, of the global health, of the global community, and yet has only about 3% of the health workforce. Africa today spends not more than 1% of its public health spending, public spending on health. Globally, 1% of the global public financing of global health expenditures on health for Africa. And that is poor enough. That is not enough investment in a health system. That is not enough investment in a health workforce. That is not enough investment in infrastructure and other, factors that can serve as, very attractive platforms for health workers to be retained in their countries.
Dr. Enabulele, there was much talk about the issue of the push factors. Can you enlighten us or refresh our minds what some of these push factors are, so that we can have an understanding of what is pushing doctors away from the country?
Well, in the last 20 years, we've been talking about these same push factors and pull factors, particularly in African countries, to let them know of how they can drive what I call an equipoise between these push and pull factors to serve as some level of encouragement for their own professionals to remain in their countries. Now, when we talk about push factors, we are basically talking about those objective conditions in the source countries. Source countries are countries where these professionals are migrating from to other countries which are known as destination countries. So in those source countries like Nigeria and other African countries where you have very, very serious challenge of health workforce crisis because of the continuous migration of the health workers to other countries, we're talking about those factors in those countries that encourage this level of migration. So those are the push factors. So they are pushing them away from those countries to other economies, whereas those other economies or countries are pulling them. So they are generating factors to pull, those professionals from the source countries to their own countries, which are known as the destination countries. So that, in a nutshell, is what a push factor is. So in our country, for instance, in Nigeria, as ditto most other African countries, you're looking at issues of health infrastructure, for instance, the working conditions, for instance, the pay disparities, for instance, the issue of security, the issue of the health system workability and functionality, the issue of the motivational factors on ground. They are not really there compared to those other countries and economies. So how do you tell somebody who is earning less than a tenth or a tenth of the salary of some other person in another country not to migrate when there is no effort to even bridge the gap? How do you tell somebody in a country with very high level of insecurity from migrating? How do you tell somebody in a country that has very poor working conditions for the workers,
all right,
in terms of conditions of service and the workplace environment, from migrating? So migration is an international phenomenon, and no statement is enough to restrict it, apart from putting on ground pragmatic and proactive actions, like the likes of Priti Patel, the likes of Matt Hancock, of the British healthcare system, British system, has done just now.
All right, Dr. Nabulele, certainly from everything you've listed out, Nigerians really feel that impact as well. And we thank you for what you're doing, and we continue to encourage you to engage with government for the betterment of the sector, as well as Nigerians who are the receiving end or who should be the final beneficiaries of all of these. Thank you very much for your time on the program.